welcome to all of you. Very good afternoon on behalf of HEAL. We started this network with the purpose of training and capacity building of health writers, editors, and of late the health and nutrition bloggers in this part of the world. Informally, we started with health writers workshops in 2005. We have done approximately 150 workshops. In this journey of 14 years, we have touched base with approximately 1,000 health writers, editors, bloggers, feature writers, reaching to not less than 50 crores of people in an effort to inculcate positive health attributes and making India healthier.
NCDs are one of the critical challenges which everyone is facing, and this is not going only in India. It's a global concern, and this is something which has kept everyone on the toe.
It's not just the sweetness that we get from sugars. In today's day and age, there are multiple sugar sweeteners which can be used for cooking.
How do we substantiate the scientific evidences where low calorie sweeteners are safe and this has been scientifically proved?
We start by testing the toxicology. There is many organizations that have set out proper standards to test these compounds.
Unfortunately, there are many studies that have been published in journals which do not follow these guidelines, and their conclusions do contribute to the controversies that we're discussing today.
Non-nutritive sweeteners can definitely be potential, option for diabetic patients because it does not impact the glycemic index.
Low calorie sweeteners are better. Second, it's low in calorie. It's very sweet that you'll end up using very much.
India ranks number 1 in the world when it comes to the number of cases of COPD in the world. We lose an economy of around 45,000 crore rupees every year only because of this one disease called COPD.
In COPD, which two diseases are involved?
Bronchitis and emphysema.
That's correct.
देहदान करना या अंगदान करना एक बहुत बड़ी सोशल अवेयरनेस का काम है. If my eyes can live after my death, if my heart can live after my death, if my skin can be used after my death, there can be no better religious act than this. And all superstitions have to be free.
We are having the third edition of Ayushman Bharat. Because for us, Ayushman Bharat is not just about that scheme. It's about a healthy India. But I can say that to some extent in creating that awareness about a healthy India, HEAL Foundation has played a very important role.
Such a scheme was very much required. 10 lakh people go below poverty line every year just by one health intervention. So PMJY's helped address that issue to a great extent in a lot of areas.
Ayushman Bharat, this mega scheme since it has been launched, has actually created ripples around the world. If Ayushman Bharat has to really be successful, medtech industry can play a major role even there.
It's a 1-year-old program, biggest in the world, and it will take time for hospitals, patients, and the government to understand the whole landscape.
Health is fundamental. We are moving away from a system of roti, kapda, makan, now to shiksha, sehat, and sadak. Because if we take care of healthcare, the productivity of nation will take care.
HEAL is a completely independent body. I think it's a great platform. It's doing amazing work. It's doing very, very relevant work.
This is my third HEAL Foundation's Health Writers Convention. We have the opportunity to interact with influential dignitaries. I think this is a wonderful platform for me.
This is the third time that I am attending HEAL Foundation's Health Writers Convention. And I have found that every year, year by year, my horizons have really broadened with my participation over here. We have got to learn a lot here, and the sessions this time have been really extremely helpful.
There is a high rate of malnutrition in the country. Therefore, we need diversity, nutrient-rich crop production such as millet and pulse.
Good reporting from your side, right reporting from your side can really change patterns. On the one hand, people resort to better nutritive habits. On the other hand, farmers are able to switch to crops that give them better incomes and that also add to the farmers' own better nutritive habits amongst themselves as well.
We don't look at
technology replacing us. We look at technology assisting us. Every day when we get into the theatre, we use like high-end microscopes which allow us better visualization into our anatomic field. So that also increases our ability to perform complex procedures and give better patient outcomes.
When I look at what Medtronic was maybe a decade back to where it is today, it's really focusing on meaningful innovations. The only objective is to ensure that the patients get better health outcomes.
70% of the population in India lives in the rural areas, and 70% of the technology is available in the urban areas. So the technology should be developed in that direction, which would be of high quality, which would be efficient, and at the end of the day it has to be accessible.
The topic a bit over here is also about fake news, how journalists can overcome fake news, and how which are the sources of fake news.
People are inclined to believe false news at least 20% of the time. And many a times you will find that these are inaccurate stories which are going around. And there is no way to identify the source or refer to the source.
But the important thing to maintain is the trust. In a country where a lot of people still need access to healthcare, in case the trust between this ecosystem and patients, if it is broken, then it creates something which is not healthy for the country.
If the first report, even if that is refuted later on, the first report itself has tarnished the image of that institution or as a person in private, and once that image is tarnished, whatever you do later, you can't really have it back.
I really feel privileged to be here because there's a chance to interact with so many health writers, especially people who write and make masses aware about this program, and it's a great platform to be here.
Thanks for inviting, and it's been a wonderful experience. The thing is, many of these things we know, but it's been re-emphasized. We are also reminded that, in our daily rush to fill in the pages, we should not forget these important issues.
Preventive healthcare is important to take the agenda of healthcare forward, and the role of media journalists will be very, very important to create greater awareness and get focus on prevention of healthcare.
What will you do if the person is unconscious and he is breathing? If he is breathing, put in recovery. If he is not breathing, do CPR. The happiness which you derive when you see a victim breathing, you will not get it anywhere else in this world.
Today, we use our smartphones for everything. So why can't we use our smartphones to help us manage our health? Digital therapeutic products take proven medical guidelines and interventions that already exist and deliver it in a consumable manner to the patient.
And can we say, what is the definition of the quality? I think it's the general definition is the right work at the right time, for the right clients, by the right provider, and the affordable quality, not quality. But very simple definition, जो आपको चाहिए वो दूसरों को दो, that means quality, nothing more than this.